prolapse, uterovaginal prolapse, pelvic organ prolapse, cystocele, bowels, rectocele, weak pelvic floor. Hi guys, welcome back to my channel. Today I wanted to chat about a really important topic, and that is uterovaginal prolapse and tips to reduce your chance of issues after having a baby. So uterovaginal prolapse is a really important topic because we know up to 1 in 2 women after having a baby will actually experience some form of prolapse. So let's talk about your lady parts. What exactly is a prolapse? So a prolapse is where some of the pelvic organs are coming down in the vagina. There's a cystocele, which is your bladder coming down in your vagina. There is rectocele, which is your rectum coming down in your vagina. And there is a uterine prolapse, which is your uterus coming down in the vagina. There are so many different risk factors for prolapse, and many of those we can't actually alter. Things like having a pregnancy, having multiple pregnancies and birth, mode of birth, size of your baby, so over 4 kilos definitely increases your risk. Genetics, if your mum had a prolapse, probably increased risk. Age that you had your baby at, increased BMI, and also things like chronic cough and chronic constipation. Here are my 10 top tips for reducing your chance of symptomatic uterovaginal prolapse after having a baby. Number 1, look after your perineal area to avoid infection. So things like having a couple of showers a day, padding the area dry, changing your pads regularly, you can use ice, and avoid excessive sitting for the first 24 to 48 hours. Number 2, make sure you do some lying down after having a baby. That's right ladies, you deserve a break. So I usually advise for 2 hours of lying down each day after having your baby for those first few weeks after your baby is born. Number 3, make sure your bowels are regular and make sure you go to the toilet if you have that urge. Make sure you drink copious amounts of fluids and ensure lots of fibre in your diet, and some women even need some stool softeners to help this occur. Number 4, avoid heavy lifting, and don't you dare touch that vacuum after having your baby. Even if you feel fine, make sure you don't pick up anything heavier than your baby for the first 6 weeks, and that includes your heavy toddler. Number 5, avoid coughing if you can. If you have a cold or you have asthma or any reason for a cough, make sure you get that looked at because coughing will put excessive strain on your pelvic floor. Number 6, learn how to get out of bed like an old person. Do a log roll or to stay in bed. Google log roll. It's a really good one, and the physios will teach you how to do this in the hospital to help reduce the strain on your abdominal wall and then reduce the strain on your pelvic floor. Number 7, practice good posture. We know that if you're slouching, it will increase the pressure on your pelvic floor. Number 8, do your pelvic floor exercises. Many women will be comfortable enough to do some of these within a few days after having their baby. And make sure you check in with the physio at the hospital to go through these with you. Number 9, engage with a pelvic floor physio during your pregnancy and after your pregnancy for a tailored program. You will find that if you engage a pelvic floor physio during your pregnancy, you'll be more likely to be performing your pelvic floor exercises properly, and they can also provide you with a tailored program for pelvic floor rehab after having your baby. And final one, please don't do high impact exercise for the first 10 to 12 weeks after having a baby. And it does not matter which mode of birth you had your baby, whether it was a vaginal birth or a cesarean section birth. This applies to both modes of birth. By simply being pregnant, the heavy uterus and pregnancy has been putting a lot of pressure on your pelvic floor during the pregnancy for 9 months. So you do need to allow time for your pelvic floor to recover. So I hope that chat was helpful, and I hope you learned something, and make sure you like and subscribe and hit the bell for future notifications. Baby's crying, gotta go.